her would-be son-in-law, but she made sure that she cleared out the family safe, just so that she can go and live this life with this young man who apparently she felt was treating her better than her husband. And that was made evident by when the man called his wife, she didn't pick up, ended up calling his would-be son-in-law, of course, ex-would-be son-in-law. And that one told him off in no clear terms that he had been stressing his wife since now. You should just forget about her and move on. And I'd asked, if you were the man in this case, that is the husband whose wife eloped with your would-be son-in-law, what would your reaction be? I'll leave the phone lines open for maybe the next 3 minutes, and if I don't get any response from there, we'll move on. But just to let you know that things indeed are happening, and they are happening indeed. Speaking about things that are happening, but this one on a more somber note and a more heartbreaking note, Chima from Apo rather had a response concerning the killings in Plateau, Benue, Kaduna and Taraba. He said these things are incomprehensible. These killings have lingered for more than 2 decades, especially in Plateau State. And whenever these killings took place, the reactions that would follow were, we must bring the culprits to book. We would deal with them decisively. And a committee will be set up to unravel the cause or causes of the killings. Then the corpses will be counted without profiling and mass burial will take place. Why are human beings counted like chickens in this country? When shall we value the sacredness of human blood? When will the actors in these heinous actions be brought to book? Chima from Apo. So many valid questions. And we just seem to go on year after year, month after month, with these questions unanswered, largely from the action or inaction on the part of the people who we have entrusted our safety to, who we've entrusted our welfare to. And I start by placing this on the table of the state governors, because they cannot be so oblivious of what is going on and who is committing these crimes. And they cannot be so helpless as well that these things will persist for so long. Now take it up again, another notch, to the federal government. There is a numbness that is settling on the people, and it is a horrible place for us to be. And I don't know how else to say that. We need to take our country back. We need to take our people back by ensuring that something as basic as protection of lives and property is given priority by our elected officials and the people we've entrusted leadership to. But there it is. We would be wrapping it up. Okay, it's 10:04. I think we can bring the doctor on at this point. Body and Soul kicks off right now.
You on a late night rendezvous where intimacy meets insight, where we explore the secrets of smart lifestyle choices, sexual health, and the science of self-care. With leading medical experts guiding the conversation, we're here to educate, empower, and ignite your curiosity, because your body and soul deserve the best. Late night just got a whole lot hotter and healthier. Body and soul, because you deserve to feel good inside and outside. Thursdays, 10 p.m. on Tonight with Somi. It's 10:05 p.m. Let's get to talking about our bodies and our souls, the things that will make our bodies perform as they should, the things that will make our bodies act as they should, so much so that our soul gets to sing. It's time for us to talk health and lifestyle here on Tonight with Somi. And I am glad to say that we have Dr. Felix joining us today.
to pick up the conversation from where we started last week when we had the big one on. We started to touch on some of the I think we touched on types of contraception, also talked about some of the issues that people have with them, sort of explain what they were and all of that. And today we are going to be debunking myths. And I thought it was important to do this because I know some of the conversations that we had last week pretty much went over people's heads, in the sense that men see contraception to a large extent as a female thing. It is a more publicized notion that it is a female thing as opposed to a male thing. And so we're going to be talking about some of the perceptions that surround male contraception today and seeing if we can work to debunk them. And our consultant urologist is here with us once more this evening. A very special welcome to you, Doc.
Good evening, Somi.
How are you doing?
I'm good. How was your day?
Lovely.
Thank you.
Yes. And yours?
I'm good. Thank God.
Okay.
Yeah.
You look like you just came in straight from work.
Well, not necessarily, but somehow.
Somehow, I see.
Yeah.
Well done.
Yeah.
Well done.
Thank
you. So, like I said, we started to talk a little bit about contraception last week, where we missed you because we were unable to get you on last week. So, I mean, in debunking some of the myths, I'm sure you might want to speak to one or two types. But as much as we're doing that, let's dwell largely on the myths that surround the types that you're speaking to, so that it gives a clear picture, and then we can go and address it from there. But I want to start the conversation from this point today with a myth around male contraception in itself. Some people believe that it is more of the responsibility of a woman when it comes to contraception than men. Let's start by clearing that up. Is it a 50-50 thing? Is it more of the women? Should men really be having these conversations? Or should we just jump and pass and just deal with the myths around the various types itself?
Yeah, actually, contraception is not just the business of one party. It's actually both persons, the man and the woman. Just the same way when we talk about fertility, you can't discuss fertility without discussing both people involved. No single person can achieve pregnancy, just like no single person can stop pregnancy, in quotes. Yes, so that is why everybody has to be involved. But we know that sociocultural things have affected some of these things, such that people have received some traditions from, based on traditions, there are certain things that seems that, the woman tends to be more involved. Just the same way once a couple after marriage are not having a child or not able to conceive, first is to suspect the woman. But we've come to see from our previous discussions and from all the awareness that has been created that it's not necessarily the woman that may be the problem. Sometimes, if not as much as 50%, half of the time, men are contributory, to what exactly happens. That's the same way for contraception. Both the men and the women are actually involved, and everybody should discuss it. It's something, because if a woman wants contraception and the man doesn't want, it's going to create some form of disharmony, and that can lead to some form of sexual dysfunction, as well as all kinds of problems in the home. So even if it's the man that's going to have the contraception done on himself, the woman needs to be aware. Just like if the woman is the one going to put in something to ensure more children doesn't come, the man needs to be aware. It's always good to have this cooperation so that everybody can be at peace. Granted, the laws does not say that you must get the consent of the other party for contraception to be instituted. Of course, I mean, the law doesn't say that, but it's always good for consensual harmony as well as peace, that both people should actually be involved, should be aware, should, desire it, and also ensure that the practices around contraception are kept, because no contraceptive is actually 100%. So failure rates actually many time, in some cases comes from the fact that the rules are not kept properly. So these are the things. So it's something to ensure that everybody is involved. Yes, so to say.
Okay. I must touch on something you said real quick before we move on. You said no form of contraception is 100%. So last week, I had my in-house guests touch on a few of them. And of course, there was the one around, I think, is it periodic abstinence or something like that? Are you saying that even that one is not 100%? If you're abstaining for certain periods of time, say maybe when, as a man, you're abstaining from sex with your partner because maybe she's ovulating and she's in a period where eggs are being produced and all of that, you want to abstain from that, as opposed to 100% abstinence. That's what I'm talking about. A periodic abstinence. Are you saying even that one is not 100% guaranteed when it comes to contraception?
Just like you said, you really, give the answer. 100% abstinence and periodic abstinence are not the same thing. The only one that is 100% is when you abstain 100%, meaning that you don't have sex
at all. Of course,
yes,
so periodic abstinence can still birth the baby.
Because even though we know there are what we call safe periods for a woman, but that safe period, is not 100%, meaning that at any cycle or any part of the cycle, a woman can become pregnant. The eggs can be released at any time and pregnancy can happen. Not to talk about the fact that if you understand the physiology, the spermatozoa can actually be in the female genital tract for some days, such that you may think she's gone off her safe period. And as soon as the egg comes, the spermatozoa that has been waiting quietly will just come off and say, "I catch you, I catch you." And that becomes pregnancy. So really, of course, periodic abstinence has its place as a form of contraception, but it's not 100%. It's 100% because of all these other factors. Not to talk about that, the cycle sometimes can vary. The woman may think she's not ovulating, but she has already ovulated. So all kinds of things that can come up. So the only thing that is 100%, if you want to put it, is total abstinence. But in that case, that means these people actually can't be discussing contraception per se, because when you're doing total abstinence, more or less, you're not sexually active. But contraception, if you want to discuss it in its traditional form, it's actually for those who are sexually active. Mm-hmm. Who enjoy the pleasure of sex. There are methods or ways by which you prevent unwanted pregnancy. That's contraception, actually. Mean that you still get the pleasure of sex, you enjoy the experience, but you employ ways, strategies, and processes, to ensure pregnancies that are not desired don't happen. That's what contraception basically is in its simplest form. So if you now say total abstinence, then it means, by default, that's not really contraception. Or except you also want to say that every young man, and woman that is single and not married are all under some form of contraception.
Well, technically speaking.
Technically speaking, but we know that's not really what we are discussing per se.
Okay.
That's what I said. Yeah.
I get your point. Okay. All right. So thank you for providing that clarity and also for opening my eyes just a little bit, because somehow, I looked at periodic abstinence last week and I was like, okay, this is one that men can try, because some of the options available to men, and we're going to come to the conversation around how accessible these options are as well to men. But some of the options that are available to men, of all the ones that we touched on last week, I'll just run you through them real quick. There was the vasectomy, which is the permanent one. There was condoms, which are the most popular. And then we talked about, I think it was Resug or something like that. The one that is reversible, that has to do with non-hormonal what is it called now? Injections or something like that, which, which affects the man's ability to produce eggs, or affects the motility of sperm, and affects the motility of the man's sperm. We'll touch on them real quick, but I want to let you get the floor on that one, because like I said, in debunking the myths, I'm sure you will speak to some types and then debunk the myths around those types. But let me just read out one here that I saw. I want to get your thoughts on it. I think this will have to do with research. Again, I feel like I'm not getting the name right. I just know that it is a reversible, non-hormonal injectable. I think I would go back and check it out. But for some people, I've heard that there's a male hormonal birth control or contraceptive for men, right? And some people have, they hear the word hormone, and for some reason, it makes them worried that it would turn them into women rather. Like it will reduce their manliness, or reduce their, is it testosterone? It's the testosterone that is the male hormonal component, right? Yes. So it's been said that there are male hormonal birth control contraceptives available to men, and there's been the saying for men who have heard this that say, God forbid that I would take this thing. Anything that would make me start to look like I'm a woman or change me to a woman on the inside, I would not take it. So what are your thoughts on that one? I think it's a question about side effects of taking it. They feel like the side effects, that testosterone is reduced, and they're, having more female hormones as opposed to male. So what are your thoughts on this, Doc? Let's start with that one.
Okay, yes, just like you said, actually, the hormonal contraceptives for men, many times, there are various types, but one of the main type which is used is an exogenous form of testosterone, meaning that you're giving the man, synthetic testosterone so as to suppress the body's testosterone, So usually what it does is that, when you give that testosterone, it suppresses the body's own testosterone, but at the same time, it does not necessarily increase the man's female hormone, because you're also giving testosterone, but just that it's synthetic. And this synthetic testosterone does not have that ability to really, strengthen the processes of sperm production, just like the one that the body produces. That's the principle, because first, it's not given at the normal, physiological timing, so to say, for most of the testosterone, medications, either the oral or the injectable. Some of them are given weekly, some of them are given monthly, some of them are given in form of oral medications. So they supply testosterone, which is the male hormone, at the same time, they suppress the body's own store. So the only thing now is that what they fear for quite a number of men, why most men don't really accept this, is that, when it suppresses your own, body's testosterone, supposing you now want to begin to have children, is it going to reverse? Yes, theoretically, it reverses.
Theoretically?
Yes.
Not practically.
No, not as okay, let me finish.
Okay.
Yeah, theoretically it reverses. They're all reversible, meaning that after some time, if I had many times after 6 months to 2 years of stopping these medications, expected that your body will begin to produce its own testosterone. That is that's the theory behind it. Practically, yes, reversal is seen even in practice, but sometimes may not be complete. Body's response varies, individual response. Just like we said, many times, most of the things that we know about humans, are usually seen in just 1/3 of the population. 2/3 of the population have all kinds of variations, which many times it's only when you have patients you can individualize and see how to respond. So that is just some of the fears around it. Why, some men may not subject themselves to that, So, but otherwise, yes, it's actually an option. It's actually an option in terms of, men can actually receive testosterone injections or oral testosterone to suppress the endogenous testosterone so that they don't produce sperm at that time.
Okay.
Then when they stop after some time, it's expected that their body will begin to produce testosterone again, and they can now achieve, fertility again. And
Okay.
there are other drugs that can be used, for this purpose. Even there's the one that actually not just testosterone, but rather what it does is that it provides one of the hormone that comes from the brain, and by that, suppresses the body's ability to even produce testosterone in the first place. So that's the one that even to some extent causes some form of, feminization, meaning that the man begins to look like a woman to some extent, because that one, it's not that it's supplying testosterone, it's suppressing the body's store of testosterone, and the female hormones may now increase. Yes, that one is available.
What is that one called, so that listeners know perhaps not to venture into that area?
Well, it all depends, choices varies.
Okay.
It's called a gonadotropin releasing hormone analog.
Okay.
Mean that the gonadotropins are those hormones that are produced from the pituitary gland, which is located in the brain. Normally the physiology is that when they are produced from the brain, they stimulate the testes to produce testosterone. But now when you give a synthetic type, first it is given in such a way that it causes a rapid stimulation beyond what the body
can handle,
ordinarily made to handle. So by that, it will now eventually, initially it will increase the production of testosterone, then later it will now suppress it completely. See. Yeah, so that's the principle. So there are other hormonal contraceptives, but generally, most men, because of all these, little side effects, are not so open to testosterone. Not to talk about the fact that there's a prostate cancer, which is one of the most common malignancies, or one of the common malignancies affecting men beyond the age of 50.
Yeah.
Testosterone has some relationship with prostate cancer. Yes, necessarily it does not increase the risk, but for those who already have risk factors, it may actually fuel progression. So these are all the other things that surround testosterone and those hormonal things, why sometimes people shy away from it.
Okay.
So those are the things. So most men would rather favor to use either vasectomy, which is a permanent form of contraceptive or contraception, though it's also reversible. It can be reversed, yes, of course.
Okay, we're going to talk about that in detail, because as of last week, when we were speaking on it, the understanding was that it is permanent. Are you saying vasectomies are reversible now?
Yes, it's actually meant to be permanent, but just like tubal ligation in women can be reversed if need be, you can actually reverse it. But in this case, success and failure rates now becomes important, because the fact that the patient comes for reversal, after reversal, success may not be very good, so that the person may not still be able to have viable sperms that can eventually result in fertility. So that is the problem with that, and that is why many times it's described as being permanent. But of course, there are procedures to reverse it. You can actually reverse and reconnect the tubes.
Okay.
If there's a need. Yeah.
All right. So on this one point about the hormonal contraception available to men, thank you for clearing that up. Apparently, one just needs to get better educated on the kinds to use that will produce more as opposed to suppress the testosterone within the men, because I'm told that is the major fear that men have. So in terms of suppression, what you would most likely see is men would then start to have side effects. They might start to have mood swings, acne, as is what is typically seen in women. And in some stages, I'm told that breast growth sometimes can be a side effect. So
that's very correct.
So it's important. Yes.
Hot flushes, just like what women
as
have
you see in women.
Menopause.
Okay. Yeah. All right. Thank you for clearing that up, Doc. Let's go on this quick break. When we come back, we'll look at the other myths around male contraception, and then, of course, the phone lines will be open for interaction.
Uncaged, who rise when the night falls, fire burning brighter.
Connection established.
Audio Jungle.
Welcome back. It's Body and Soul, and we are talking about contraceptives, especially as it has to do with men. Lots of things you get to hear about it, whether as a result of social cultural influences, and sometimes it's just general misconception, sometimes it's misinformation. And so Dr. Felix Magnus, our consultant urologist with Shiva's, right? That's the name. Sorry.
Shiva Specialist Hospital.
Thank you so much. Shiva Specialist Hospital, who is doing the Lord's work when it comes to everything that has to do with men and their bodies and their sexuality, their performance, just general health when it comes to that, is here with us debunking some myths. around male contraception. I'm going to go straight ahead and open up the phone lines right now in case people have questions, in case the men have questions, in case the women have questions, especially as regards understanding the role of the man when it comes to contraception in their relationship, in their their family and all of that. The phone lines are open. WhatsApp is open for conversation. Don't let Doc and I just keep talking and talking and talking. We don't want to talk at you. We want to talk with you. And speaking of talking with you, we are streaming live on Facebook and YouTube. Go to Nigeria Info 95.1 Abuja on both platforms, and then you can send in your questions there as well, and we can interact. Some concern that you have, perhaps you are listening in and you've heard other things around male contraception that you would like for the doc to clear up. Now is the time to do that. So while we're waiting for the lines to start buzzing, let Doc address this other one. I mean, you spoke about vasectomies just before we went on the break, and you were talking about how they can be reversible. But let's address one myth, and then we'll come back to that conversation. Some have said that vasectomies kill your sex drive, or worse still, make you less manly. That's a myth around this particular type of male contraception. It's been said to be one of the extreme ones that men would take, and men who usually find themselves, I don't know, let me not be speaking for the men here, but I think that men who usually find themselves at the point where they have to go for a vasectomy as an option are really, really most likely done with anything that has to do with having children, do not want to be caught in that WhatsApp group of having children, do not want to smell or hear that somebody is trying to have a child by them, and so you find them going to that option, which is considered one of the more extreme ones. But some people have said, why will I do that? It will kill my sex drive, or it will make me less of a man. What are your thoughts on this, Doc? Vasectomy as male contraception.
As a male contraception, vasectomy is one of those good option of contraception that should be recommended to anyone who has completed their family size and doesn't want to have cases of maybe much failures, because it has a very low failure rate compared to most other forms of contraception for the men. Yes, but in terms of whether it affects sexual function, no, that's a myth. It does not. Vasectomy does not affect the sexual function of a man by definition. However, some men, because of lack of awareness or maybe appropriate education or knowledge, may feel that at the end of sex, when you don't have semen or you don't have an ejaculate coming out, that may suggest you've not done it properly. So that possibly is a psychological fixed point that they need to come off, so that they don't allow themselves to be thinking that way. Because with vasectomy, the only thing that is done is that the tube through which sperm comes out is severed and separated so that you don't have sperm coming out. But it doesn't affect your orgasm, it doesn't affect your erection, except maybe by your own traditions, as well as how you've always known it. You feel that after every sex there must be some form of ejaculation. If that doesn't happen, that means the sex wasn't good enough. So in that case, it's psychological, but not necessarily because the vasectomy should affect your sexual function. That's what we're saying. It does not affect your sexual function. It doesn't interfere with your orgasms. It doesn't interfere with your erection. It totally prevents you from having unwanted pregnancy because you have decided that I don't want to, release sperm at the end of sex. So these are the things. So it's just all about education. Just re-educating this person. Yes. So it's a myth to say that vasectomy has some impact on sexual function or erection, any of those things.
And it's a myth to say that it makes them less manly as well. That was the other angle to it.
Yeah, it's a myth.
Okay.
It's a myth. It's not correct. Yeah.
Okay, so it's interesting that you said this just now, because I think my guest last week, to some people's, for the first time they were hearing it, I believe to some extent, even myself, I was a bit shocked by that. We're made to understand that you can orgasm without having ejaculation. And
That's
you
correct.
can ejaculate. I don't know. Can you ejaculate without having an orgasm? You can do
Yes.
that as well. So these two things are separate things. So in the case of someone who has a vasectomy, they can still have a full-blown orgasm without the
Yes.
ejaculation, and everything will still be okay.
It's fine, because even some persons who have never had a vasectomy, they have what we call anorgasmic anejaculation, or they have orgasmic anejaculation. Orgasmic anejaculation means that they had orgasms, but there was no ejaculation. I don't know if you're getting?
Yeah.
Somebody who has had a vasectomy.
Yeah.
But for them, they didn't have a vasectomy, just that they had a disease process that made it impossible for them to ejaculate even after orgasms.
Okay.
So, but it doesn't affect the orgasm. That's why it's called orgasmic anejaculation.
Okay.
That's different from, anorgasmic, where the person doesn't even have an orgasm and doesn't also ejaculate. What we call anorgasmic anejaculation.
That one is a sexual dysfunction. Am I correct?
They are all forms of, they are all sexual dysfunctions.
I see. I see.
Like we said, there are a lot of things about sexual dysfunctions and stuff.
Okay.
So mean that, whether you have an orgasms, it doesn't mean that you must ejaculate. So if you've had a vasectomy, you know why you shouldn't ejaculate. So it's all about you now coming into that awareness that because of vasectomy, I won't be ejaculating. Of course, but I'm sure, when you discover vasectomy, you also need to make people understand that it's not immediately after vasectomy that you stop ejaculating. It takes a while. Usually, the spermatozoa that are in the distal part of the vas deferens, or where you cut, will keep coming out. So usually it's after 3 months that most men will attain an ejaculation following vasectomy. Such that after vasectomy, we still encourage them to use, other forms of contraception, usually the barrier method where condom comes in, so as to ensure that they don't have pregnancy until, at 3 months they will check, do a semen analysis. If there's no more sperm, then of course they can now continue even without any other form of contraception. But just like we said, once in a while there could be some failure rate, so that whatever the contraceptive method you're using, you should also be aware that failure rates are there. There are cases where some person's vasectomy has recanalized, so that even though you separated the tubes and you cut them apart, eventually by some processes they join themselves, and you see yourself ejaculating when you didn't expect it, and your wife becoming pregnant or your partner becoming pregnant when you didn't even plan for it. Those things happen. That's what we call failure.
What are the chances of that? What's the failure rate of a typical vasectomy?
It's actually less than 2%.
Okay.
Less than 2%. Yeah, less than 2%. Or rather, not failure rate. Actually, overall failure rate is more than that. But failure rate from recanalization, mean that if it's due to rejoining of the tube, it's about less than 2%. But overall failure rate may be from not keeping to instruction. For instance, after vasectomy, the man did not use maybe barrier method and just kept firing, thinking that, I've been set free, not knowing that it takes about 3 months for sperm to stop coming out. So if you don't keep to that instruction, of course, there'll be failure rate, but it's not due to the process itself. It's just that you didn't keep to instruction. So failure rate is about close to 18 to 20%, but in terms of from recanalization, of course, is quite low. Just like you can also have what we call accessory vas deferens, where the main vas deferens that usually we know where it's located, and you can easily go there and tie it up, cut it and tie it up. If some people have some variations where they have another smaller tube that also transports sperms, and that was not located or identified at the time of the procedure, in which case it wasn't severed, they can still keep ejaculating even after vasectomy has been done. So though it's some rare condition, but it can happen. So we're saying that these are some of the things that can make somebody who has had vasectomy to still have some failure rate, in addition to not keeping to instructions. Yes. So those are the basic things about it.
All right, that's clear. Any side effects typically for someone who has a vasectomy? Because I'm looking at a research that says once it's done, I think recovery is typically less than a week. And then after that, 95% of men are said to report no long-term changes in their sexual function. But other than this recovery period, and of course you talked about the 3 months before they, absolutely stop, they're supposed to absolutely stop ejaculating. Any other side effects for a man who has a vasectomy?
Yeah, some of the side effects usually are local. For instance, maybe pain at the site of the procedure, some swelling once in a while, bleeding, or the wound getting infected. Yes, but those are not something to worry much about. They can easily be managed and handled properly. Yeah, those are the basic side effects. The other things, just like you said, 95% of men report no change in their sexual function. Of course, some people have also said that vasectomy may increase the risk of somebody having a prostate cancer, but studies have shown that that is not true. It doesn't increase the risk of anybody having a prostate cancer. The risk is still the same as the general population, so that's not really a side effect. But by and large, it's actually a safe procedure, and the side effects are not really so much or difficult to handle.
Okay. All right. Remember, the phone lines are open. Let's interact, people. Let's talk. We are talking about male contraception. I see a Jalil Oyewumi with a message here. It just says, good evening. Well, good evening to you, Jalil. And I hope that the conversation is making sense to you. All right, Doc. I mentioned about two, if I'm not mistaken, about 2 or 3 myths around contraception. Let me defer to you. For someone who is in the medical field, I'm sure you've probably had patients come in and express certain fears based on what they've heard that turned out to be myths. What are the most common myths that you've had to clear for people who have come in and had these fears when it comes to male contraception?
Okay, well, when it comes to male contraception, some of the things we've had to handle or myths that are not true, just like you said, some men believe, not just even the men alone, even their partners believe that vasectomy will affect their sexual function, particularly their erection.
Okay.
And that is why many times, even some men may want to submit themselves for vasectomy, but their partner will say no, because they don't want any excuse. They may say, maybe for the man will say it's because of the procedure, that's why I'm not able to satisfy you, or my erections are not always constant, which of course we debunk, because just like you said, 95% of people report no change in sexual function, meaning that vasectomy shouldn't affect sexual drive, shouldn't affect erection or any of such. That's one of the most common myths why many times men don't commonly come to request for it in this environment, because they don't really want anything to affect their sexual function, and they think vasectomy may affect it, even if they feel that, okay, can I go ahead? Their partners are not comfortable with that too. So that's the most common myth. Of course, some people also express the fears that supposing they change their mind tomorrow, or something happens and they want to have more children, what is the reversal rate in terms of, can it be reversed? Which I said, yes, of course it can be reversed. But even in reversal, there are no guarantees that it must succeed. The only thing is that if having a child is your major concern, even if there's a failure following reversal or reversal surgery, you can actually go for other forms of assisted reproductive therapy, where sperms can be extracted from the testes directly or from the epididymis and used for IVF or intracytoplasmic sperm injection. So you can still have your own child that carries your DNA and your genetic makeup, so to say. So we're saying that these are some of the things people express, like fear of not being able to have a reversal when the time comes.
Okay.
Or if they have a reversal, will this succeed? Of course, we counsel them on all the possibilities. Reversal is possible. If it doesn't succeed, you can go for assisted reproductive therapy like IVF or ICSI, and that's still very fine. Of course, there are cases where studies have shown, or we've also seen that even for those who have successful reversal, quite a number of them, because of the procedure, may have what we call anti-sperm antibodies. Anti-sperm antibodies, such that the sperms that are produced subsequently after reversal may come under attack by, may not be very mortal. They will not be able to move properly. Some of them may even be dead, because the body's own soldiers called antibodies will be attacking its own sperm, and that's quite some of the things that procedure can cause for some persons.
Okay.
So these are some of the things, yeah. But by and large, the myths surrounding vasectomy are more or less just like what we said: fear for sexual, sexual dysfunction, then fear of the possibility of reversal. Those are the common things, basically.
Okay.
Yeah. Yeah.
All right, so men, you've heard from Dr. Felix. Don't let any woman make you feel like you will not be manly enough if you choose to go with a vasectomy as as your contraceptive of choice. But speaking of reversing and reversible, the one that I was trying to remember, RESUG is the acronym for it.
RESUG, yeah.
Yes,
yeah.
so it's the reversible inhibition of sperm under guidance. That one is non-hormonal.
It's non-hormonal.
Yes, it's an injectable. I'm told it's a polymer gel that will be injected into the vas deferens that will block sperm transport. So that's another option, right? Any myths around that one that we need to dispel? Any side effects that men need to know about in case that's a path they're thinking of towing?
No, it's a good option, even though of course success rate from this, because just like you said, it's a chemical substance, that is injected into the vas deferens to obstruct it, to block it so that sperm doesn't pass. So some of the things may be the fact that, the chemical substance there may even dissolve, before the anticipated time, because depending on when they are injected, some of them can stay up to 1 year, or more, depending on the duration and the type. There are even some of them, like the Adam, that looks like IUCD, that one stays up to 1 year. So in that case, if you don't keep to the timings and everything, there's something may just, the obstruction that was created may get off and you won't know, and pregnancy can result. Not to talk about that, the procedure itself sometimes can create some kind of pain. In which case, when it's injected, the person's response may not be very good, so that the person may keep having some pain around, the scrotum, and that can be very discomforting. And it's also a foreign body. A foreign body means that infections and other things can follow procedures like that. Yes, but otherwise, actually one of those non-hormonal contraceptive method that is actually good. It's reversible. When it's done, patient can actually use it for the duration it's meant, and it can always be removed, just like IUCDs or any other things that are done for women.
Okay, so we've touched on a number of options, and we've tried to address possible myths surrounding some of these options. Let me throw it back to you, the listener. If you're listening in right now, perhaps you've never thought of male contraception, or you've thought about it. I would like for us to hear from you. First and foremost, which one do you think you would use, if at all you are considering male contraception and you're listening in right now? Let's talk. Call me in and let's talk about it. And then also, of all the ones we've got, which one would you rather use if the option is available to you? And then we'll take those contributions, and then we'll get to accessibility of options, because some people have said, or it's been said, that you can't really blame men when it comes to their reluctance to use contraception. I don't know if really that's the thing, because somewhere I read that even the idea that men are not so quick to employ contraception might just be a myth. Let me read what I saw here. It said, so a survey done from NIH, I think that's in the UK, if I'm not mistaken.
National Institute of Health,
Exactly. It showed that 50% of men would use a male pill if available. I don't know if we have those options available here in the country. Females have the pill that they take up morning after, whatever you call it. Do we have the male pill available here in Nigeria? And because this report is saying men would consider it if it's available.
Yeah, that's a very good question to ask, because first, some of those availability are determined by, the forces of demand and supply. So, you don't expect, a pharmaceutical company to begin to stock something that nobody has requested for. I know when we talk about male contraception or male contraceptive, we should exclude discussions around condom, which most men do. We touched on that. Because if and these are the things, looking at all the other things, most men rather would prefer using a condom, because first it's really available, it's easy to use, and many times, in more than 98% of cases, can prevent pregnancy. if it's used properly. Of course, we talk
If
about
it's used properly, yes.
correct and consistent use
Mm-hmm.
of condom. Yes, correct and consistent use. Of course, condom has its own problems, in which case it may take away some of the spontaneity of sexual pleasure, because you're already doing the foreplay and you think you want to climb up the palm tree. So in that time, you now
climb
remember
up
that,
the palm tree, Dr. Felix. What a reference.
well, I'm sure the men understand what it means to climb up the
I'm
palm
sure
tree.
they do.
Yes.
Okay.
So you're already in the euphoria and excitement that this whole place is getting good, and you want to climb up the palm tree. All of a sudden, you remember that, oh, I've not even worn the condom. So that process of trying to wear the condom, some men will tell you that they lose erection. And they may not have an erection immediately again, and the whole mood is killed.
Yeah.
And the whole process now becomes soulmated. So, of course, those are some of the challenges with condom. Why, some men will say if they have a pill they can take, they would rather prefer that, because but just that quite a number of persons will still go for a barrier method, which is condom.
Okay.
Because in addition to the fact that with condom you can use spermicidal agents that will also increase the chance, or rather, make the contraceptive method more authentic.
Spermicidal agents. In my head,
Yeah.
I pictured insecticide. Please help me dispel that picture in my head. Please, what is this spermicidal?
Spermicidal agents are, agents or gels that destroy sperm cells. Meaning that, for instance, when it's applied over the condom,
Yeah.
or even if it's not over the condom, when it's inserted into the vagina of the woman, so any sperm that one way or the other escapes the condom, either by the condom breaking in the process or slipping off, usually the gel, that spermicidal gel, will kill off the sperm, so to say.
Interesting.
And so those things are valuable.
Okay.
So in which case you have more security. So these are some of the things why these things being available. I mean, condom is available.
Okay.
Spermicidal agents are available.
Okay.
Let's talk about that. In addition to just contraception, condom also has the additional advantage of protecting from some STIs, which other forms of contraception doesn't have. So these are all the reasons why it seems the men, of course, especially in this part of the world, may not
typically,
always be
yes.
So it's so important to mention that condom has a very strong place
in
the contraception.
Makes sense. Makes sense.
Yes.
Okay. All right. Thank you for clearing that up, Doc. It's like the men are shy today. I do have a message here, but it's not on topic. I will get to that in a little bit, but let's see if we can allow for maybe in the next 1 minute any calls rather to come in before we bring the conversation to a close. If you're just joining in and you're wondering why am I hearing penis, vagina, condom, vasectomy, don't worry. We're talking about a contraceptive as part of our conversation on body and soul around reproductive health. So we're looking at all the aspects of reproductive health all together. We started the series with sexual health. Now we're on reproductive health. So we're going to be looking at different aspects of it in the weeks to come. And we're focusing on male contraception today. So feel free to send in that question or that concern you may have. And I also asked the question, as a man, in case you have never considered it, which would you rather when it comes to male contraception of all the ones we've discussed? Let's take this real quick. Hello?
Hello, good evening.
Yes, good evening. You have less than 30 seconds.
And there's a question I want to ask, but not like senior to what people are discussing.
I'm so sorry, it's not clear. What did you say?
This is a question I want to ask.
Okay.
But it's not senior to what people are saying. What may be the...
Sorry, the line is not clear. I need you to call me back. Take your time and call back after this break.
Energy igniting. In the dark, we find our freedom. A world of our own. Our playground.
This is Nigeria Info.
Nigeria Info.
Yes. We are still on the conversation of male contraception on Body and Soul, and we're going to be wrapping up the conversation in another 10-15 minutes thereabout. Just to say that if you're watching via the stream, don't worry. If it goes off, Doc will still be here with us till the end of the conversation to take your questions and any other concerns you might have. So just once the stream ends, just go straight to your radio or your device, and you can continue the conversation from there. Hello, good evening.
Hello, good evening. I'm the one calling back.
Thank you for calling back.
Question I want to ask. Can you hear me?
I can hear you. Go ahead.
What may be the cause of pain from all those coming out from men's body?
What may be the cause of odor from men?
Yes.
Which part of the man is the odor coming out from? Let's be clear, because some people have body odor. That is clearly a hygiene thing. Is there a specific part of the body that the odor is coming out from?
I don't think this actually there's a neighbor close to me. Last time I used to go very well, but any part as in kind of odor that always perceive.
Okay. All right. That's the question, right?
Yes, sir.
Okay. All right. Thank you. What's your name, though? You didn't tell me your name or where you're calling from.
This is Blair.
Okay. Thank you so much.
Thank you.
All right, then. Doc.
Yeah.
Let's maybe expand on it a little bit. In the event that this might be something that you see in the course of your work, the question was, what is the cause of men that have odors coming out of them? And in my head, I'm like, okay, body odor is not specific to anybody, but is it possible that in the course of your work, you've had to encounter people with a specific type of body odor, maybe as a result of a sexual dysfunction or something? Or is that just something that you don't see at all, so that we can know that we just advise this person now to maybe tell the neighbor to take a bath more often and, use deodorant or something?
Okay, well, just like you were trying to get from her, what part of the body? If it's coming from the genitals or something, maybe, well, that also still bothers more to hygiene, or the person has some infection around that area.
Okay.
In which case, the person should be treated and also pay attention to some hygiene. But there are no specific form of body odors, so to say, that is indicative of sexual dysfunction per se.
Okay.
It's either the person has some form of STI, or the person is not paying attention to hygiene. Usually that's what, or maybe the person has some form of malignancy. Of course, if there's a cancerous process there, tissues are dying, of course, dead bodies smell. So if there's a cancerous process and the tissues are dying, and the person has not been treated, of course, it's going to smell. So I'm saying that it also depends on, I think the question is quite broad. Mm-hmm. So it may just be good to really look at this person properly and know exactly what the problem is. Yeah,
okay.
But infection, maybe malignancy hiding somewhere, hygiene, and all the things possible.
So you mentioned infection, so that would allow me to bring up this particular comment here, and also maybe we can then from that point shed a little more light on maybe the kind of infections that may cause those kinds of odors to come about. But Daniel from AY had written in earlier on to say, good evening, Somi and Doctor. What are the signs of infection in men, and does infection really affect sexual function? Yeah. Okay.
There are quite some number of signs. First, some persons may have obvious discharge from their penis, from their urethra. I mean that, instead of, when they stay, they will see some pus coming out from the penis. That suggests some form of, infection. Some may even have pain. Pain on urination, pain on sexual intercourse. Even the discharge that comes out have different colors. Some can be whitish if it's due to some form of fungi. It can also be yellow. Some can be foul smelling. Different kinds of smell. Some can even be fishy. Have some fish odor. So those are all signs of infection.
I'm sorry, fishy odor. That's typically associated with women.
Yes, but of course, it's typically associated with women. Doesn't mean a man cannot pick it up from a woman.
Ah.
Yes, of course. If the man has gone to feast at the place where the fish is located, then of course
He is going to do point and kill.
he's going to come home with the same fish.
Okay.
So these are all the things. So there are different things that may suggest some form of STIs, pain, discharge, sometimes even obvious swelling. Sometimes you can see some rashes around, the penis. There's this rash that looks like, the cold sores that people usually have following malaria. The one that is found around the angle of the mouth. For those who have high fever.
Yeah.
Yes, it can also happen on the genitals, especially for men. The something is that even for some persons, like a patient I had at a point, a person never really knew it was something that was sexually transmitted. The person just finished shaving and now noticed some rash that looks like cold sores on the penis, but not where he shaved. So while he was trying to, attend to it and maybe apply one or two topical agents or cream, something began to spread and began to become more.
Oh.
Yeah, so that's when the person reached out to me. I said, no, this is not just shaving bumps. It's actually a form of STI. So we began to, and herpes genitalis actually appears like that. Just like you can see some kinds of wart-like swelling around the penis. What the way wart looks like.
Please describe for those who don't know.
Some warts can look like flower. You see some kind of flower-like growth. Around the
oh my days, really?
Or even coming out from the urethra, like a patient I managed recently, a young man. In fact, he thought it was just because while he was having sex with the girlfriend, it was a rough, he said they really enjoyed themselves and he felt it was quite a rough, it was quite aggressive. So after the something, he went to urinate, he noticed a little blood. Then he now checked and saw that there was something.
Okay, let's bring Dr. Felix back on very quickly. Daniel Fomewa, I don't understand your question. When you say you don't mean STI, you mean other infections. Perhaps you could be a little bit clearer. Doc, Daniel is back here. He was the one that asked what are the signs of infection in men, but he's now saying that he does not mean STIs. STIs are sexually transmitted infections. So Daniel, when you say you don't mean STIs, what possible other kinds of infections could you be talking about? Because you also followed up by saying, does this infection really affect sexual function? So Daniel, I need you to clarify so that the doc can provide the kind of answer that you need to hear. Okay? So Doc, you were finishing up a thought on that. Let's quickly do that. And then I see my phone line ringing. So we can take a call or two before we wrap it up.
That's fine. So, like I was saying, like a patient I managed recently, he thought the blood he noticed after the sex was due to the rough nature of the sex. He now saw a fleshy-like, swelling jutting out from the urethra, from where urine comes out from. So he thought it was due to sex. So, but eventually, when he came looking at it, I told him, no, this is not, just from the
from
injury
rough
from
play.
sex. It's a form of STI, a form of sexually transmitted infection. And we evaluated him. In fact, we even had to take him into theater to do a procedure where we put an instrument, a rod-like instrument that has some lighting and everything, so we can look into the body. And we saw that besides the one we were seeing coming after, there were a lot of them looking like grass all throughout his urethra. So that was human papilloma. It's human papilloma virus.
HPV.
So it's not just, we were saying that, HPV. So we're saying that all those things, that's once you see anything that doesn't look normal around your penis, don't assume. It may be a sign of infection, sexually transmitted infection, swelling, discharge, pain or urination, and all kinds of things. Even sometimes it even look like, some people may say it's the weather, like harmattan, like the skin is becoming encrusted.
Yeah.
Yes, but that suggests some form of, sexually transmitted infection. Even sometimes you see some people, even in public, they'll be itching their penis, itching, so that they even get carried away and they don't even know that scabies, which can be sexually transmitted too. So we're saying that there are all kinds of sexually transmitted infections.
Okay.
Ways manifest, itching, discharge, swelling, bleeding, and all kinds of things.
I'm getting goosebumps just hearing you talk about it, but these are conversations that we must have, so let's have them regardless. I have a call coming in on WhatsApp. Let's take it very quickly. I hope that we will be able to hear. Hello? Hello? Hello, good evening.
Yes, can you hear me?
Yes, I can hear you.
Yeah, good. Can I be anonymous?
Absolutely, you can.
Okay, my question is simple. What could make a woman very when you penetrate? I want to make love with her.
Ask the question again, please.
What could make a woman very hot in there when you penetrate her and want to make love with her?
Okay, let's have the good doctor answer that. You people are taking me off topic, so I would say this is the last question that I will entertain that is off topic. I asked about contraception. Nobody's even answering me. At least if you have a follow-up question, let me know first and foremost which one you are likely to use as a man. You people are taking us completely off topic, but it's okay. After this one, we'll stay on topic, I believe. So, doctor, over to you.
Yeah.
The question, did you hear him?
That what makes a woman frightened?
No. He said what makes a woman very hot. Like he's penetrating her and in there she's very hot. What makes that happen?
Okay, well, that may be that she's stimulated and also, of course, with all the swelling response, the secretion, yeah, that place may be hot. Then, of course, also depending on if the person has some form of discharge, meaning that some inflammation is ongoing there, that can also make the place warm, or hot as the case may be. Then if the person has a fever, the body generally is hot. So that place is also part of the body. So that place can be hot. So it also depends on what this person calls, what the person is describing as the place being hot. But there are things that can make the place hot. Maybe the act of stimulation. So the person is pumping a lot of secretions. So those things will really be warm. Then if there's infection, one of the cardinal signs of infection is that it produces inflammation. And inflammation comes with some form of heat. So that can suggest.
Okay.
So it's good to watch out for that. There may also be as part of a general body, hotness, fever, maybe the person has some malaria or something else, so it also depends. Yeah.
Okay, so if you're anonymous and you're the one who called in, the advice is probably maybe the person, if it's within your control, to let the person get checked so that you know exactly what you're dealing with. Of course, if the person is not feeling well, you would know, you should know. But if it's that this is your constant, this is what happens as a result of your constant interaction with the person, you may want to get it checked. Okay, a few more calls and then we will wrap it up. Please remember, stay on topic. If you do have another concern, it's okay. We can take it, but at least do me the honor of at least answering my question first. I'd asked, what is your preferred choice of male contraception? Try and answer that one first now before you take me off, yes? So let's take the calls. Hello?
Hello?
Yes, good evening.
Yes, good evening.
Could you turn down the volume of your device, please? It is interfering with our communication.
Thank you very much.
All right, go ahead.
Yes, my name is Emeka. I'm calling from Airport Road.
Go ahead.
Yes, I would like to answer your question before I ask my own question. I
Very
think
nice
based
of
on
you.
the explanations. Yeah, based on the explanation so far, I think I rather go for the one that you need to insert inside the woman's body while going, other than going for condoms or taking the male's pill, because the male pills might not work immediately. Do you understand? And now going also on the condoms might not, give you the sensation you want personally. So I rather go for the one you inside the woman's body. Then when you go in freely and enjoy yourself and come out.
Okay, so basically you are saying that you would not use contraception. You would rather that the woman uses it because that's the only one you insert in her. Okay, I hear you. Go ahead, though. Go ahead with your question.
Please, I would like the doctor to expatiate more on scabies. I heard him mention of scabies as sexually transmitted infection. Let him explain more. because I have seen so many of cases around scabies.
Okay. All right. We'll let Doc respond to that. Thank you so much. Okay. I saw the phone lines buzzing. That was a WhatsApp call. Let's see. Let's be sure that I can take as many questions as possible, so Doc will answer all of them at once. Doc, the question was on scabies just now, but let me take some more calls and then we'll take it all at once. Is that okay?
That's fine.
Okay.
That's fine.
Hello, good evening.
Hello, good evening. This is Beck calling back.
Go ahead.
Please, can I ask you a favor? Please.
It depends.
If I have the doctor's number.
Yeah, we can do that. But you will have to send a message to me via WhatsApp. I have no means of sending it to you except you send me a message on the WhatsApp number. Find a WhatsApp number and send it, because I have no other way of sending it. I can't call it out on air. And I cannot send you an SMS on the number you're calling on. All right? Whenever you get the WhatsApp, don't worry. Even if I'm here tomorrow, you can just use someone's phone, send me a message, and I'll send you his number. Okay? All right. Thank you. Thank you. All right. I have a voice note here. Let's listen.
Okay.
Good evening. My name is Ben. I'm chatting from the book. When the doctor was talking about this infection of a thing, he made mention of she's coming out from the mouth. So I sometimes do see something like a boil coming out from, you understand? Not consistently, not always, but some takes a while, you understand? So I know sometimes when I put out the pulse, you understand? So I don't know, maybe it's because of the shaving. I used to shave. Just a single boil like that usually appears. And I discovered a woman, it showed me something again like that. And I was like, okay, it's not particularly to me. So I want to know if maybe something like that. Good evening, Artist Me. My name is James. I'm chatting from the book. When the doctor was talking about this infection of a thing, he made mention of she's coming out from the mouth. So I sometimes do see something like a boil coming out from, you understand? Not consistently, not always, but some takes a while, you understand? So I know sometimes when
I wish I understand, though. You said it twice, but
you understand?
No,
I don't know. Maybe it's because of the shaving. I used to shave. Just a single boil like that usually appears. And I discovered a woman, it showed me something again like that. And I was like, okay, it's not particularly to me. So I want to know if maybe something like that is kind of an infection or something like that.
Okay. It was a bit difficult for me to understand, despite the fact that he said it so many times, because I didn't get where the boil was situated. I didn't get that. I take one more call, Doc, and then I'll come to you. Hello?
Oh.
Hello?
Yes, good evening.
Yeah, good evening, Somi. How are you?
I'm well, thank you. What's your name and where are you calling from?
My name is Mohammed, calling from Pabi.
Welcome, Mohammed. You want to answer my question and then pose your own question?
I just want to beg for a favor. I have a little complaint about prostate. So maybe the doc can put more light on it.
Okay, let me just take 30 seconds of that and then, yeah, go ahead.
Okay, let me be fast. It's been a while now. I can't pass urine. I went for scan and PSA test and urine test, and they said I have enlarged prostate. And I can't ejaculate, and now that I cannot pass urine, it's now causing me some pain around my navel, to my testes, then down to my legs. All I'm feeling some hotness in it, as if I'm standing on fire. So I wanted to go for, I think, a surgery, but I was having a challenge with my eye because I am a diabetic patient. So I have to undergo some surgery in my eyes, and the two eyes I have to undergo surgery. So first, they will give you a month. So it took me about 2 months now to undergo the surgery in my eye. So now I'm to face the prostate. So I don't know if that hotness in my leg and from my navel to my testes to my penis, whether it is caused by the prostate or how I want the doctor to shed more light for me, small on it.
Okay.
What are the signs and the feelings?
Okay.
All my experience.
All right.
The prolonged prostate in your body without being attended to.
Okay. So here's what I'm going to do, because that is way off topic for today. We plan to get to some of those things much later in the segment, but your case is clearly something for more indication that, needs as immediate attention as it can get. So I would refer you directly to Dr. Felix. I don't think that's a conversation that can be had right now. Our time is fast spent. We are about to wrap it up. Or Doc, am I correct? He's asking about certain signs based on the diagnosis of prostate. Yes. So Mr. Mohammed, if you can send me a message on WhatsApp, I will forward doctor's number to you so that you can have that conversation with him. It is so far off what we're talking about today, and time will not even allow us, even if we wanted to. But because of how important it is to your health, send me a message on WhatsApp and I'll forward his number to you, please. All right? Thank you so much. All right, Doc, so I think the only one that that perhaps you could use to wrap up the conversation today from all the calls that came in is the conversation around scabies. The caller said, please shed a little more light on that because it came up when we're talking about STIs. So if you can just maybe take the next 2 minutes to touch on it briefly, and then obviously, STIs are a big deal to the listeners. We might have to come back with an episode on that one where you can fully address all their concerns. But for today, please just 2 minutes to talk on scabies, as you mentioned earlier.
Okay, thank you very much. So just like I was saying, scabies is also one of the sexually transmitted infection, even though classically, unlike some other sexually transmitted infection, it is more or less like a skin-to-skin, transmitted sexually, or a skin-to-skin transmitted infection that happens during sex. What do I mean? Scabies are usually found on fomites like clothing, underwears, and they tend to thrive in areas of the body that are not usually open or exposed to the air. For instance, some persons may have pubic hairs that are, quite significant, or rather, that are well grown. So if they have scabies, it can be hiding there. So in the process of having sex with them, you can have contacts with the scabies in their pubic hair, around the skins in the genitals, and by that, scabies can be transmitted. So that's the most common way by which sexually transmitted scabies can be transmitted as a form of sexually transmitted infection. Okay. Of course, scabies can also affect other parts of the body like armpits, even also using clothes of somebody that has scabies. When you wear it, you can actually get scabies. So it's not just only from the genitals, but we're saying that as part of, sexual activities, somebody can actually contract scabies because of that skin-to-skin contact and contact with pubic hair. That's what we're saying.
Okay. All right, then.
There are also all kinds of sexual transmitted infections like that, like the herpes, human papillomavirus. They are usually from contact first. Any form of contact with the skin or body fluid has it. Those things can be transmitted like that. And that is why condom, though is protective to a lot of STIs, can't really protect from some of these ones because, condom does not cover the entire genital area. It just only covers the shaft of the penis.
Yeah.
So that if the pubic hair comes in contact with, the partner, then of course scabies can be transmitted, like herpes and human papillomavirus that are on the skin there can actually be transmitted. So these are some of the things that happens during, sex and can result in STIs. Yeah. Right. So by and large, just like we've discussed, contraceptive methods mainly protects against pregnancy. The only thing is that condom in addition can protect against some STIs.
Right.
Yeah.
Okay. Yeah. All right. That is where our conversation on body and soul comes to a close. It is 11:23. Even if you don't want me to go and sleep, Benga needs to go and sleep. He's been streaming since 10 o'clock. And we need to wrap it up right now. Thank you so much, Dr. Felix Magnus. Remember, if you need his number, just reach out to me via WhatsApp so that some of the conversations that couldn't be had on air, you can have that with him in person. And I'm sure he will be very glad to help. Special thank you to you once again, sir. And we'll see you next week. Clearly, like I said, we need to have a I think this one is on me because sexual health. I think STI was a core component of sexual health, and we didn't have that, so we kind of rushed it. So we'll definitely come back with the segment to deal with STIs. Yes,
that'd be nice because it's a very big aspect of sexual health.
Okay,
and it's so important.
Okay,
yeah. So yeah.
All right then.
So thanks a lot for having me on this show.
Thank you.
Thank you.
We appreciate you. Have a lovely night's rest then.
You too. Good night.
Good night.
Thank you.
This is Nigeria Info.